What is partial hydrolyzed guar gum, or PHGG? PHGG is a natural water-soluble dietary fiber extracted from the Indian cluster bean. It is produced by milling the endosperm of guar seeds and subsequent enzymatic hydrolysis, which breaks down guar gum into smaller particles. PHGG has a smaller molecular weight and less viscosity than native guar gum. PHGG is stable, does not hold much water, and has a bland flavor. It is soluble at the pH levels commonly found in foods. The low viscosity makes PHGG more suitable for feeding through smaller sizes of nasogastric feeding tubes. PHGG fiber is fermented by gut bacteria in the large intestine. During the fermentation, short-chain fatty acids, acetate, propionate, and butyrate are produced. Fermentable dietary fibers alter the gut environment with the production of short-chain fatty acids and changes in the gut microflora. PHGG, similar to other dietary fibers, increases the concentration of bifidobacterium in the gut. The ability of dietary fibers to alter the gut microflora is considered a prebiotic effect and may improve immunologic status. Consumption of PHGG also decreases beta-glucuronidase activity, putrefactive products, and ammonia content of feces. Butyrate serves as a major source of energy for human colonocytes and plays a crucial role in colonocyte growth and differentiation. PHGG fiber is fermented by gut bacteria in the large intestine. During the fermentation, short-chain fatty acids, acetate, propionate, and butyrate are produced. When compared with other frequently used fibers, it is indicated that the fermentation of PHGG produces the highest levels of short-chain fatty acids after 24 hours. The luminal pH is the result of the microbial short-chain fatty acid production and the neutralizing capacity of bicarbonate. As the concentration of short-chain fatty acids decline from the proximal to the distal colon, the pH increases from cecum to rectum. The drop in pH from the ileum to the cecum due to the higher short-chain fatty acid concentrations has two effects. First, lower pH values change gut microbiota composition, and second, it prevents overgrowth by pH-sensitive pathogenic bacteria like Enterobacteria and Clostridia. The short-chain fatty acids are absorbed by the colon, which is associated with stimulation of sodium transport from the colon, allowing the water absorption. Short-chain fatty acids have different metabolic pathways. Acetate mainly follow a colonohepatic distribution pattern. Propionate can be either utilized by colonic cells or enter the colonohepatic distribution, while butyrate is solely used by the colonocytes as an energy source. The mucus layer is a dynamic barrier, a reservoir of antimicrobial peptides and immunoglobulins, and it is the first structure that a mucosal pathogen must overcome to establish an infection. Its integrity is therefore critical for a healthy gut. A gut with a reduced mucus layer has open tight junctions and a higher permeability, increasing the risk of bacterial translocation and gut-originated sepsis. By supporting the gut microbiota with regular consumption of soluble fiber, it can strengthen the mucus layer and help prevent erosion of the intestinal mucus barrier by mucin-degrading bacteria and pathogens overgrowth. Enteral formula diet containing PHGG results in significant improvement of acute postprandial glucose and insulin response. From scientific studies and clinical practice, we can conclude that PHGG is highly effective in both pediatric and adult patients' population, in managing or preventing diarrhea and constipation in children and adults, modifying the gut microbiota by enhancing growth of beneficial bacteria, lactobacilli fecal bacteria, ruminococci, and bifidobacteria, and lowering blood glucose levels. The NovaSource range are the only enteral formulas for sole source of nutrition with PHGG. NovaSource products are developed to offer nutrition for patients with disease-specific needs. Proven to increase lower gastrointestinal tolerance due to the unique partially hydrolyzed guar gum fiber, PHGG. NovaSource GI Advance for ICU patients. NovaSource GI Balance Plus for diabetes patients. NovaSource GI Control for patients with isocaloric needs. NovaSource GI Forte for patients with higher energy needs. NovaSource GI Protein for patients with high protein needs. The range includes the following formulas: powered by PHGG, the NovaSource family of products can deliver many unique patient benefits.